Watch original photos and videos related to this news by clicking on the link given in the description below the article courtesy. Please subscribe our YouTube channel Listen News Here. If you like the video, please like, comment and share the video. Days after it announced it was extending spring break and going to online classes, the University of South Carolina said students will not be allowed to stay in on-campus housing because of concerns about coronavirus. USC students will not be allowed to reside in Columbia campus residence halls unless they demonstrate extenuating circumstances, the university said on its website. Students will not be permitted live in those residences until at least April 5, USC officials said. That includes fraternity and sorority houses. Students with no other housing options can apply to stay in the campus homes. The form is available online and must be submitted by 5 p.m. Monday for consideration. This decision is based on advice from healthcare experts and is designed to protect the health and safety of our students and the community, the university statement said. Students living in close quarters can rapidly spread the coronavirus and significantly increase the chances of a major outbreak. Through Tuesday, Gamecock students who have registered with University Housing and the Greek Village can go back to their rooms to retrieve essential belongings, USC officials said. The rest of USC's campus remains open, including food services and some transportation, according to the university. All other campus events through April 5 have been cancelled, and all sporting events, including games, practices and meetings, are suspended through April 15, USC reported. Spring break will now run through March 22, and no classes will be held during that time, USC officials said on the university's website. Additionally, all classes from March 23 to April 3 will be conducted virtually, the university said. All face-to-face instruction in lectures, discussion sections, seminars and other similar classroom settings will be suspended, USC officials said. Coronavirus cases. Click or touch the map to see cases in the South Carolina, Georgia area. Pan the map to see cases elsewhere in the world. The data for the map is maintained by the Center for Systems Science and Engineering at the Johns Hopkins University and automated by the Esri Living Atlas team. Data sources are WHO, USCDC, China NHC, ECDC, and DXY. Data is updated every hour. Note, some cases from the Diamond Princess cruise ship are grouped in Japan on this map and do not show up in the US. This unprecedented public health challenge demands that all of us do our part for the public good. It is in this spirit that we ask each of you to rise to the occasion and remain flexible over the coming weeks, USC President Bob Caslen said in a news release. South Carolina Athletic Director Ray Tanner said one Gamecock student-athlete was tested for COVID-19. Another student-athlete came from a country with a Level 3 travel health notice, and that individual is now on self-quarantine. Tanner said he did not know the outcome of that test. He did not specify either student-athlete's sport. On Saturday, 6 new cases of COVID-19 were announced by the Department of Health and Environmental Control, bringing the total number of cases in South Carolina to 19. That includes the first reported case of coronavirus in Lexington County. A man who lived in Lexington nursing home run by Lexington Medical Center was transferred to the hospital, according to DHEC. The man had no known exposure to another case and no travel history to an area where the virus is present, South Carolina officials said. State epidemiologist Linda Bell said that officials are working closely with the Lexington nursing home to immediately investigate possible exposures in an effort to mitigate any potential spread at this facility. Bell said the nursing home has been completely cooperative in working with the DHEC, and that the facility is following the procedures recommended by the DHEC and the Centers for Disease Control to help protect this higher-risk population. As of Sunday morning, 156,400 people worldwide have been diagnosed with coronavirus and 5,833 people have died, according to Johns Hopkins University. In the United States, 2,952 people have been diagnosed with the novel virus. In the U.S., 57 deaths have been reported, including 40 in Washington state, according to Johns Hopkins. DHEC is encouraging people to practice social distancing to help stop the spread of the virus. Social distancing is staying away from unneeded interactions with sick people and from large groups of people. It also calls for remaining at home unless it is absolutely necessary to go out. Symptoms of coronavirus vary from mild to severe and include coughing, sneezing and shortness of breath, according to the CDC. The best way to prevent infection is to wash hands for 20 seconds, avoid touching eyes, nose and mouth, avoid contact with sick people and clean frequently touched objects with a cleaning spray or wipe, according to the CDC. It does not matter whether the water is hot or cold, Bell said. Prisma Health is offering free access to medical professionals for those who think they may have coronavirus, the state reported. People experiencing COVID-19 symptoms can go to https://www.prismahealth.org/virtual-visit/ and schedule a free online visit, Prisma officials said. Free online screenings also can be accessed by going to scdhec.gov/COVID-19. The U.S. Surgeon General has urged members of the public to avoid buying protective masks because they are ineffective at preventing coronavirus, and buying them saps vital resources for health officials who need them.